when we are talking about a laboratory network, we are talking about a collaborative group of laboratories in a country, starting from the lower levels, to the district, to the provinces, and to the national level. And the function of this collaborative group is affected by many different key stakeholders.
We have also worked with Zimbabwe in terms of strengthening their laboratory systems and networks by supporting them in the establishment of a calibration and service of equipment center.
ASLM has collaborated with and supported the Ministry of Health, particularly laboratory services in Zimbabwe, in a very big way. We've done several projects together, laboratory system strengthening projects together. The assessment findings have helped us in a big way to identify the weaknesses that we have in our system, the strengths that we have. So now we have a pool of trained SLIPTA auditors who are now serving the country as auditors. They are implementing the quality management system using the SLIPTA checklist, and we have SLIPTA auditors who were trained by ASLM.
I'm also with the One Health Secretariat in Zimbabwe. Within the Secretariat, we are coordinating AMR activities using the One Health approach. We've been working together so well with ASLM, and we have been trained in so many issues pertaining to antimicrobial resistance. We also got trainings on quality control. Then we also managed to get 2 personnel trained under the QAS training. We're not really doing the tests in a way that was, say, recognized internationally. Yes, we have data, but not much data. So we need more evidence-based data.
We have an MOU with the ASLM. We have agreed on the training programs. We are going to be starting the CPD training programs. We expect to offer certain courses which ASLM has been offering already.
We tend to have some gaps postgraduate programs. So we hope that they keep on establishing more programs. We also, as an association, hope to foster the collaboration of ASLM with our training institutions so that they also have space in them in terms of supporting them and also getting some spaces to share the knowledge for the betterment of the profession.
The One Health concept has actually been adopted very well in Zimbabwe because currently under the Fleming Fund grant, it has managed to bring the medical labs, the environmental labs, and the veterinary labs together. Central Veterinary Laboratory is an ISO 17025 accredited lab, and currently we have 4 sections that are accredited. We've also collaborated with ASLM on the accreditation, especially on the antimicrobial sensitivity testing, and we have had a lot of help from ASLM in conducting our proficiency testing. The Central Veterinary Laboratory has got 17 tests that are accredited. We have got 5 satellite laboratories, and from these 5 labs, there are 3 labs that are part of the Fleming Fund grant, which is the Mutare lab, the Blawayo lab, and the Mashingo lab.
We've worked with ASLM, I think, for a number of years now, done projects together in terms of trainings and mentorship. And lately, we actually signed a memorandum of understanding. Since ASLM has an academy, we also want to tap into their expertise and their wide network across Africa.
We would appreciate more support, and I mean, just from the results of this project, I was mentoring myself 4 labs, and of the 4, 3 of them got accredited. Their testing has improved. The 4th lab is still currently going for accreditation. They had challenges that they faced, but they are still on that journey.
I'm happy to say that we now have also managed to establish a calibration unit here at the National Reference Laboratory. We have also managed to establish a National Biorepository unit here at the Reference Laboratory. So these are some of the success stories that we allude to the support and collaboration that we have with the ASLM, and we are very grateful for that support.
Are the populations in our communities actually having that access to all their testing needs? We have to look at the network, whether it provides that high quality kind of testing, and we want to assure the community that we have a functional laboratory network that delivers.